Becky, and we are going to show administering packed red blood cells. So I have already checked the order from the doctor, and he wants packed red blood cells, and I would check for allergies, and I'll gather my supplies, and I would make sure that I have my signed informed consent. So now we'll go into the room by Betty. Hi Betty, I'm Becky. I'm gonna be your nurse today. The doctor has ordered packed red blood cells. So can you give me your full name and date of birth? And she says Betty Jones, 5/21/1952. And that's what I have. Betty, are you able to follow my commands if I were to ask you to do anything? And she said she would. Okay, Betty, have you ever had a blood transfusion before? And she says no. So with a blood transfusion, you can have adverse reactions. We just want to tell you what they can be. They can be shortness of breath, if you're experiencing chest pain, back pain, itching, let us know and we can take care of that right away. I'll wash my hands. And then we are going to get baseline vital signs. We'll do heart rate, blood pressure, temperature, respiratory rate, and then I'll use my stethoscope and we'll listen to your lungs so that we have baseline lung sounds too. Okay, so now I'm going to wash my hands again, and now we're going to assess the site. We want an 18 to a 22 gauge needle, which this is. We want to assess the site for any redness, any sign of infiltration, and there is none. Looks good. Then I would flush it to ensure patency. And it has to be flushed with normal saline because that is what is compatible with blood. The blood can only stay on the unit at room temperature for 30 minutes, so I had another nurse bring me the blood. So now me and the other nurse are going to do our checks. So med record number 224466, 224466, account number 123456, account number 123456. The patient name is Betty. Patient name Betty. Red armband number 456654. Red armband number 456654. Check your band. The patient blood type is B positive. Patient blood type is B positive. The donor pool number is 7890. Donor pool number is 7890. Units in pool 4. Units in pool 4. The volume is 250 milliliters. The volume is 250 milliliters. The blood component is packed red blood cells. The blood component is packed red blood cells. The expiration date and time is 5/22 of 2020 at 2000. Expiration date and time is 5/22/2020 of 2000. Donor blood type is O positive. Donor blood type is O positive. Compatibility test and cross-matching has been completed. The compatibility and cross-match has been completed. The date is 1/2 of 2020. The date is 1/2 of 2020. So I'm gonna wash my hands. So now that that's all set, it'd be per agency policy if I were to use a blood warmer or a specialized filter. We'll look at the blood and look for any clots. Look at the color, look for gas bubbles. Looks good. I'm gonna look at my normal saline at the same time and make sure it's nice and clear and that it's not expired. It's good. So now I'm gonna wash my hands. Gloves. Make sure all the clamps are closed here. we'll start with a normal saline. Then we want to make sure that it goes above the filter. And we want to flush it so that it goes all the way through the line, make sure all the air bubbles are out. Okay, that's all good. Now with the blood, I want to invert it a couple times. I'm going to clamp the normal saline again. And we'll flush that so that they mix. I'm going to open up the blood. Then we want to flush it until that goes to the end of the tubing. Okay, I'm going to grab an alcohol swab. Then we'll clean the site per agency policy. We're going to do 15 to 30 seconds. Remove the cap and attach. Our rate, we're going to start with 50. Volume to be infused is 250. I'm going to open up the clamp. We'll press start. Make sure all the clamps are open. Take my gloves off. Wash my hands. So I will stay by the patient for the first 15 minutes to assess for any adverse reactions. And then after those 15 minutes, I will do vital signs and lung sounds. And then after that, every 15 to 30 minutes, I will do vital signs and lung sounds. If there was an adverse reaction, I would stop the infusion. I would hang another bag of normal saline with new tubing, and I would run it to keep the line open. Then I would take this tubing and the bags, and I would send it to lab, and then I would notify the physician so that he knows what happened. A lifespan consideration would be, if this were a child, I would make sure the parent was in the room so that they could also be looking for adverse reactions, because the child may not know what they're looking for. This is not complete until the normal saline runs through the line so that all the blood goes into the patient. And I would make sure that the bed's in low position, they have their call light, that they need nothing else before I leave. So I would wash my hands, and I could leave, and I would go document where we infused it, like where the IV site was, the type the size of the needle, the blood type we infused, the donor pool number, the number of units we infused, and it's saying if there's air in the line, but there's the tube, I can't get the air out or the bubbles out of it. And that's it.